April is Parkinson's Disease Awareness Month. Neurosurgeons right here in Austin are treating patients with Parkinson's and other movement disorders with a technique known as deep brain stimulation. And joining us today to talk more about it are Drs. Anant Patel, who is a neurosurgeon with St. David's North Austin Medical Center, and Dr. Dhruv Gavin, a neurosurgeon at St. David's Round Rock Medical Center. Good morning to you both.
Morning.
So first and foremost, tell us about, in layman's terms, this process that you do.
So Parkinson's disease is a disease that affects the ability for patients to move smoothly. They end up moving very slowly and are very stiff, often have a tremor, and it's due to an abnormal circuitry in the brain. Basically what we do is we install a pacemaker for the brain that kind of affects that circuitry and makes their movement more smooth and helps with their tremors.
And so you've brought kind of a model here. Explain to us what this is.
So the model shows how we go about implanting these leads accurately into the circuitry of the brain. That's kind of the most important step. You can see here the lead is very fine. It's a very thin lead which has some contacts at the top which interacts with the circuitry of the brain. In order to work effectively, it needs to be implanted accurately into the center of the brain. And this device here helps us to do that in kind of a minimally invasive manner.
Yeah, no pressure, just brain surgery. You want to make sure you get it right. And so once you put this in, do you activate it when someone is actually having a tremor or having an episode?
Yes, so usually when we put it in, we do some intraoperative testing to make sure that the catheter does respond to the symptoms. And then after the implantation is done, the neurologist will try and modulate the activity through a programmer to control their symptoms. And
is it painful for the patient? Or do they feel anything when it's activated?
Not really.
Not really. Okay, very neat. And so, you know, with this type of advance, what is your hope when it comes to treating Parkinson's?
So deep brain stimulation has been around for a while. It's not very aware of still. Probably, as I said, about 1 million people in the US have Parkinson's disease. Probably about a quarter of those are candidates to have deep brain stimulation, but probably only about 2% of those people actually receive the therapy.
Oh, wow. And why is that?
I think it's just more about awareness and also some fear about having brain surgery itself. I mean, it is a surgery that we usually do with the patient awake, so like you've seen on various adverts and TV programs with the patient playing the guitar and having brain surgery. This is a similar kind of thing that we do because it allows us to test that when we put this wire in, we're interacting with the brain in an effective manner.
Oh.
There are different thoughts on the entire process of putting DBS. There are groups that feel like you could put those patients to sleep, and patients certainly don't want to see, feel the process of having the DBS placed. But so there are two schools of thoughts on there. One's for awake and the other one's sleep DBS. Ultimately, the goal is to put the leads in the most optimal place in the brain to give you the best control of your symptoms.
Okay. Well, fascinating. And we certainly hope that this was educational for people at home so more people can learn about the process. And we thank you all for joining us this morning. We'll be right back.
All right. Thank you.